Hello, and welcome to this webinar on transparent reporting, jointly organised by the EQUATOR Network and PAHO. My name is Shona Kirtley, and I'm the Research Information Specialist at the EQUATOR Network. Thank you all very much for joining us today. It's wonderful to see so many people here. Before I introduce today's speaker, I just need to mention a few technical points. Okay, so today's webinar is the first in the series of webinars on good reporting of health research studies, organised by the EQUATOR Network and the Pan American Health Organization, under their agreement of collaboration to help improve health research reporting in the Americas through the use of guidelines that promote greater accuracy and transparency. The EQUATOR Network is an international initiative seeking to improve the reliability and value of medical research literature by promoting transparent and accurate reporting of research studies. The EQUATOR website provides access to lots of resources relevant to research reporting, and our online library currently contains over 200 reporting guidelines, covering a wide range of study types and clinical areas. We are very grateful for all the help that we have received in organising the webinar today. In particular, we would like to thank PAHO, who are providing us with free access to the Blackboard Collaborate tool and with training and technical support. We also wish to thank Cochrane Canada for training support and for sharing all their instructional materials with us. It is with great pleasure that I now introduce Professor Doug Altman. Doug is Director of the Centre for Statistics in Medicine in Oxford and is also Senior Statistics Editor at the BMJ and Co-Editor-in-Chief of Trials. He is actively involved in leading the development of guidelines for reporting research, including CONSORT, STROBE, and PRISMA, and in 2006 founded the EQUATOR Network. So Doug, I'll now hand over to you for your presentation. Thank you.
Okay, thank you very much. I hope people can hear me. I'd like to also welcome everyone to this first webinar. And as you see, I'm going to address some general issues about why transparent reporting of health research is essential. I see the research article as of key importance to progress in research. It's a permanent record of a piece of work that will be used by many users for many different purposes. While some of the readers might be satisfied with a quick scan of the article or even of the abstract, many others will want to study the article in great detail, possibly for inclusion in a systematic review, to influence their clinical practice, or indeed to inform a clinical practice guideline. And only an adequately reported research study can be fully appraised and used appropriately for those purposes. So it follows that published research articles should be fit for these multiple purposes. And some of the newer ways of publishing, for example with online supplements and with extra information, can help to meet those needs. But as we'll see, the current state of the medical literature is such that there are a lot of deficiencies, and I'm going to go through some of those. First, let me observe that a research article can be seen as the end product of its first process, the so-called primary research. We design the study, conduct it, publish it. But as well as being the end product of that process, it can be seen as the raw material for further processes. For example, the publication could feed into a systematic review, clinical practice guideline, or indeed inform further research and health policy. Transparency and value are key. The research and linked. The research will only have value if the study methods are valid and if the research is presented in a usable, transparent form. That refers both to the methods and the findings. And I commend to you this paper by Ian Chalmers and Paul Glasziou about waste in the production and reporting of research evidence, which outlines quite a lot of areas where things could be done a lot better. So, following on what I just said, scientific manuscripts should present sufficient data to allow the reader to fully evaluate the information and reach his or her own conclusions about the results. They need to assess whether they think it's a reliable piece of work and whether it's relevant to them. And thus they need a clear understanding of exactly what was done. And as I've said, there are lots of groups who might be reading this article, other clinicians, researchers, systematic reviewers, policymakers, and so on. The goal, perhaps the most important concept here, is transparency, but other aspects obviously include completeness and truthfulness. So a paper should be transparent, it shouldn't mislead the reader. I believe that a valuable concept is to have in mind the possibility or the principle that there should be enough information to allow others to replicate that study, at least in principle. I do recognize that sometimes, maybe often, it's hard to achieve that absolutely, but I do think it's a worthy aspiration. Also, it must be remembered that a single research study has potential second life in a future systematic review and a meta-analysis, and the results should be presented in an appropriate way to allow that to happen. Unfortunately, there are many aspects of the reporting of research which are suboptimal these days, and this is a brief taxonomy of 5 types. Firstly, non-publication. This is where the whole study is never published. So there's no report of a completed study, sometimes even after it has been presented at a conference. And that's the type of problem that is often referred to as publication bias, but it's important to recognize this is a failure of individuals to publish their research. It's not some abstract concept. Secondly, within publications or within reports that are published, there may be selective reporting. This is a major concern, that the reporting of the data within the published report may be biased, in particular in relation to which results are statistically significant. The third item here is incomplete reporting. The paper is published, but key information is missing. We'll come back to that quite often in this presentation. It may be key aspects of the study methodology or some of the key findings, not necessarily the same thing as selective reporting. Then there's misleading presentation, claiming a study is something that it isn't, or indeed changing the emphasis once one has seen the results, and sometimes called spin. And lastly, inconsistencies between sources. We know that what gets published often conflicts with what was intended and what is laid out in the protocol. So 2 comments about these 5 things. Firstly, they're all very common. And secondly, I'm going to give some examples of almost all of these in the next few minutes. So firstly, non-publication. This is very common, as I said. So here's some brief summary of a review of 900 trials of interventions for acute ischemic stroke. These authors reviewed those trials over nearly a 50-year period and found that 20% of those trials that were completed were not properly published, not published as full journal articles. And they noted that some of those might well be large enough to have influenced clinical practice and the findings of systematic reviews and meta-analyses. Recently, a review was published, well, not so recently now, 2009, of over 600 trials that were published in peer-reviewed journals, and looking to see whether 635 completed trials looking to see if they'd been published within 30 months of trial completion. And as you can see, just briefly, firstly, only about half of them had been published within 30 months, which is not a very satisfactory situation. And secondly, that it didn't really matter too much which country it was from, what the size was, what phase of trial it was, a little bit of difference there, and who the funder was. By and large, for all of these subgroups, there's a substantial number of trials are not being published, or at least not being published in in good time. The consequences of failure to publish studies like that is that it will always lead to a reduced evidence base for decision making. But the main concern is that, in addition, inadequate publication like this will distort the evidence base if the choice to publish is driven by the results. And there's a lot of evidence that that is indeed what happens. But as I say, even if there's no bias, the evidence base is diminished, and therefore you have extra uncertainty, which is avoidable really, and the results of bringing data together there's more uncertainty, wider confidence intervals. So let's turn now to selective reporting in randomized controlled trials. Two types. For a specific patient outcome, there are different types of analysis that might be done. You might do an adjusted or an unadjusted analysis. You might perform an intention to treat or a per protocol analysis. You might have different methods of handling missing outcome data, available cases versus last observation carried forward or some other method. And there are subgroup analyses which may be done. And all of these can be selectively reported. If you, for example, do an intention to treat and a per protocol analysis, you might then choose to publish the one which you like more, rather than the one which might be seen to be more valid, or indeed the one you said you were going to do when you wrote the protocol. So those are termed selective analysis reporting. And then for the outcomes, we also have selective outcome reporting, whereby many outcomes are collected, they're all analyzed, but only a selection are published, and those tend to be the ones that are statistically significant. And again, all of these practices are common. Here's an example from biomarkers. This is a paper where the message is in the title. Some large number of biomarker studies in cancer, somewhere between 1,500 and 2,000. Over 95% of these studies had significant results. That really is not a plausible reflection of what went on. There must be a lot of selection in what gets published. Here's another example from a review of primary research articles in Pharmacogenetics, and this histogram shows the distribution of p-values. There's a huge number of significant results and rather few non-significant results. And again, this doesn't look a plausible representation of a body of research. So there would appear to be a lot of selective publication. So as I say, we've got a lot of non-publication, we've got a lot of selective reporting. Thirdly, incomplete reporting is a big concern as well. So that studies that do get published often have key elements of the methodology and the results are missing. And we'll look at some examples. In fact, there is considerable evidence. Hundreds of reviews like this are published. I see a new one every week. Ultimately, if we don't have full information of study methods, we can't tell exactly how the research was done, and we can't really know whether to rely on it. And these problems are generic. As I've just indicated, they're not just about randomized trials. They're not even specific to studies of medicines, and they're certainly not specific to what we might call commercial research by pharmaceutical companies or other commercial organizations. We see these problems across the literature. So here's One example, incomplete reporting of in orthopedics, patient numbers. I mean, of all the things that ought to be well reported, the numbers of patients surely should be, and we see in this sample of over a third of papers, the numbers were not adequately reported. There's problems about the statistical methods not being properly described in the methods, and a failure to give uncertainty around the estimates of the main outcome measures. And those results, for example, that last one, would certainly influence someone wanting to do a meta-analysis. As a second example, and there are hundreds of these literally, this is about quality of life reporting in dermatology trials, and you can see very high percentages not describing what the questions actually were, not saying what they did about missing data, and not presenting adequate results at the beginning and at the end of the study. And one example away from trials for case control studies, this is a review of case control studies as you see in psychiatry. The reporting was poor, basic information missing, threatening the validity of the results and reducing the generalizability. As I say, these are easy to find examples of these. There are many such reviews. Very recently and very worryingly, a review of breast cancer trials looking at spin, which is the way in which some authors deflect attention from the actual results in favor of something which is more interesting. They're particularly concerned about trials with a non-significant main outcome, so-called negative trials, where authors emphasize secondary endpoints. And you can see here these authors found bias in reporting of efficacy and toxicity in a third and two-thirds of trials respectively, where nearly 60% of the trials that had no significant difference, the way they were presented was to try to suggest that they actually had demonstrated effectiveness. So that's another aspect of poor reporting. The consequence of all this poor or inadequate reporting is that assessing the reliability of published articles is seriously impeded, and clinicians can't judge whether to use a treatment, and the data can't be included in a systematic review. And clearly the consequences of that could be serious for clinical practice, other researchers, policies, and indeed ultimately all of those things affect patients. Here are some quotes from systematic reviews. I'm not going to read everything here, but if you concentrate on the purple, we have examples of complaining about poor reporting of methods, poor reporting of interventions, the data are impossible to extract, poor reporting of duration of follow-up, and again, poor reporting of data. Again, these systematic review quotations, there are many such comments, and it's deeply frustrating for those doing systematic reviews, having found these articles, not to be able to use them to the full extent. This is an example of the waste that Chalmers and Glasgow were referring to. Here's a beautiful quotation, and you can see I usually withhold the date of this, but I'm showing it all at once. A basic principle can be set up that it is at least as important to describe the techniques employed and the conditions in which the experiment was conducted as to give the detailed statistical analysis of results, and for example, how was the randomization done. This perceptive comment was made over 60 years ago. It's quite shocking that it remains the case that many published reports of trials still don't tell us this. So, spurred on by a lot of the types of evidence that I've summarized for you, came the idea of reporting guidelines, that it would be helpful to have a list of a minimum set of items that ought to be included in a report of a piece of research to provide a clear and transparent account of what was done and what was found. Those are the key ideas. What was done and what was found, that really isn't terribly difficult. These items should reflect in particular those issues that might introduce bias into the research, but there are many other aspects as well. Clearly, one needs, for example, to describe the characteristics of the participants in a study so that readers can know how relevant the study is to them. Where possible, these items would be evidence-based and the list would be derived using some form of consensus mechanism. If all research reports were to adhere to such a reporting guideline, we would have much improved accuracy and transparency of research publications. It would make appraisal of research reports much easier for their quality and relevance. It would make it much more efficient for people searching the literature for relevant studies, and so on. It certainly would help systematic reviewers. The best known of the reporting guidelines is the CONSORT statement, which is for reporting randomized controlled trials, or RCTs. The reference given there is to the third version, published in 2010. The original CONSORT statement checklist appeared in 1996 and an update in 2001. And so this one is now in its third version. It takes the form of a 25-item checklist showing the elements that should be reported in the paper, as I said before, based on empirical evidence where possible, and a flow diagram describing the progress of the patients through the trial, and that should be included in the actual published trial report. Now, most of the leading general medical journals and hundreds of specialist journals have adopted the CONSORT recommendations in the sense that they support them, and to varying degrees they encourage or require authors to follow CONSORT. The principle is that authors will not be able to hide inadequacies by omitting important information, but simply also that essential information, whether inadequate or not, should always be in the journal article. As I said, for example, the patient characteristics, their demographics. There have been many extensions to the CONSORT statement for various different settings and different designs. I've listed them on here. I don't think I'll run through those. It's become a bit of an industry, but it's an indication of the support in principle for CONSORT from many groups, and the desire to ensure that we can get the best, not just for the most popular design, the two-arm parallel group trial, but for different designs and different types of intervention. There's also a recognition that we need better information about harms as well as intended benefits in the CONSORT extension for harms. The last one there, patient-reported outcomes, is not actually published yet, but it will be soon. CONSORT has acted as a model for reporting guidelines for many other study types. PRISMA for systematic reviews of randomized trials, STARD or STAR-D for diagnostic accuracy studies, STROBE for observational studies, REMARK for tumor markers, which are also a type of observational studies, ARRIVE for animal research, GRIPS, genetic risk, and so on and so on. There are many, many more, and I put here the EQUATOR website. I'll give the address of that later. Most of these guidelines are not nearly as widely supported by medical journals as CONSORT. But none of them really, including CONSORT, is particularly well adhered to by researchers. And so their potential impact is being blunted. And although in principle these guidelines would really help to make a major improvement in the quality of the research literature, it's not actually happening. So why do I say that? What is the impact of reporting guidelines? Is the quality of reporting research actually improving? Well, the best evidence for this comes from studies of CONSORT, and very recently, this Cochrane review was published, looking at studies that considered the reporting of trials in journals that did endorse CONSORT versus those that didn't, or in journals before and after the endorsement of CONSORT, looking to see if there's any sign of improvement. I'm not giving any quantitative results here, but there were improvements. It says, as it says here, but despite these relative improvements, the completeness of reporting trials remain suboptimal. So for quite a few items, if you find, for example, that reporting has improved from 25% to 35%, that may look quite good, but it still means that 2/3 of the articles are missing that key piece of information. And one of the conclusions of this review was that the journals aren't sending a clear enough message about endorsement to authors, what they actually want authors to do. But it's a bit deeper than that, and I'll come to that in a moment. This is a review of 290 trials in solid organ transplantation. I hope you can read the text, but it's perhaps not critical. On the right-hand side is 100% and on the left 0%, and the length of the bar indicates the adherence to a particular CONSORT item in these studies. And you can see the adherence ranges from virtually 0% to 100%. And about half of the items are reported less than half of the articles. But I put a red box around the two key aspects of randomization. And it's absolutely standard in reviews like this that these two absolutely crucial aspects of allocation of treatments in randomized trials are reported less than half the time. This is the one most important aspect of a randomized trial that distinguishes it from other studies, but it's very poorly reported. Okay, where was I? Yeah. Also, I mentioned the flow diagram. The CONSORT flow diagram has been reviewed in this paper, 236 randomized trials, and you can see that a large proportion of these flow diagrams were deficient. Only 40% reported the number of patients who actually received the allocated intervention. 2/3 numbers lost to follow-up, 60% discontinuation of the intervention, and only just over half how many of the participants were included in the main analysis. So yes, they include the flow diagram, and arguably that's one of the greatest successes of the CONSORT statement, but adherence even here to the elements of that are necessary is not great. Here's a review in epilepsy research about reporting of adverse effects. I won't read everything on this slide, but that's the reference. Reporting of AEs, adverse events, is poor. These findings have serious implications as poor reporting precludes the detection of bias and hinders adequate risk-benefit analyses. Again, such studies are not uncommon. So, a sort of summary of the state of play is here. Not all research is being published, not all clinical trials are being published, and that's a major concern to many people at the moment. Those studies that are published, the research reports are seriously inadequate with lots of key information missing. Improvement over time is slow. Reporting guidelines exist for most of the main types of research. And in addition, something I haven't mentioned, that there are several statements on the responsible research conduct and reporting, pointing out the importance of the ethical and moral responsibility of researchers to report their research and to report it in a useful way. And clearly we all know that it's much easier to document these deficiencies than to change people's behavior. But changing behavior is clearly what we need now. How can we speed up progress, which, as I said, is very slow? Well, I'm not an expert in behavior change, but I know that there are no easy answers to that. There are many relevant parties, and all of them should play a role, including the ones listed there. I would include research funders and medical educators groups I hadn't mentioned earlier. I believe it's time to end this persistent widespread failure of the major bodies to recognize the waste and the harm that's associated with the bad reporting of research. So let's start with authors. What should authors do? Well, I think firstly, they should be aware of their ethical and moral responsibility to publish their findings honestly and transparently. And while one might argue that this applies to all research, I think there is an special responsibility for those conducting clinical trials, and which I think nobody is arguing with. It's just working out how to make it happen. The second point, though, which I think is puzzling, is that authors should be more aware of the needs of readers. I do believe that too many authors don't explicitly realize that the purpose of publication is communicating results to readers, not simply getting the stuff out there. I also think that the principle of reproducibility, which I mentioned earlier, should be in people's minds, giving enough detail to allow methods to be reproduced, and also the principle of having enough information for the results to be includable in a future systematic review. Authors should be aware of and follow the major reporting guidelines. Editors also, of course, I think should be aware of the needs of readers. I suspect they're far more aware of the needs of readers than many authors. They should also be aware of and make authors follow major reporting guidelines. They could do a lot more than simply include some soft statement in the instructions to authors, so that it might be helpful to consult these. I think adherence is what we need. I know that all of the reviews I've referred to and all the others are of peer-reviewed articles. All the deficiencies that are widely documented have passed through peer review. So peer review isn't doing its job properly, and I think better training, better focusing, better clarification to peer reviewers of what they actually are expected to look for would be helpful. I also think that editors should support trial registration and indeed registration of other studies and publication of protocols, and should ask to see the study protocol, and some already do these things. This is the home page of the EQUATOR Network today. The web address is at the top. On this site you can find in the Library for Health Research Reporting details of over 200 reporting guidelines. Perhaps only 10 or 12 of those refer to major study types. The others are what one might call secondary guidelines for more specialized types of study. But I recommend people to make use of this to find out what's available for their research, and to do so preferably when starting the research, not just when writing it up. So I've talked about authors and editors. What should other people do? I think research funders should have explicit policies about publication, and that failure to publish research would compromise further funding from that funder. I think ethics committees also should take more interest in whether or not the research which they sanction actually leads to publications, and they should clarify their expectations to researchers. I'd like to see responsible reporting of research taught as an essential component of research training, but I also think we need research into how to improve the way research articles are written, their value, if you like, the way in which authors can best translate their findings into knowledge for readers. The current format of a journal article is pretty much unchanged for 300 years, and we should consider whether perhaps a more modern model would be better. So coming to the end, we want to maximize the value of research. That's so obvious. It's not just money, it's people's time, commitment, and altruism needs to be taken seriously. Research is done to generate new knowledge. A research article is there to communicate that knowledge. And these articles should be fit for multiple readerships who have multiple needs. There are ethical, moral, scientific, financial reasons for maximizing the value of research, as I hope I've demonstrated. So this is, I believe, my last slide. The importance of good research reporting. Research reports should present sufficient information to allow a full evaluation of the presented data and further use of those findings. And we should always remember that good reporting is basically an essential part of doing good research. It isn't something that's an optional extra that you tack on at the end. So that's it.
Thank you very much, Doug. That was great. Just wanted to, open the floor to questions through the chat function. If you have any questions for Doug, if you could type them into chat, then we can put them to him. At the moment, we have a few here. Are you happy for me to ask those, Doug?
Yeah.
The first question. You mentioned the EQUATOR website, and that's available in both English and Spanish. But if someone wants to read and learn more about this whole topic, what sources would you suggest would be the most useful?
Well, I think that when you say this whole topic, the members of well, there are two elements to that. One is sort of general principles, similar to the material that I've just presented, and as you know, others may not. Members of the EQUATOR Network have published various articles about the principles of good research reporting. But then some of the major reporting guidelines have also published not just the guideline itself, but very long and detailed explanatory papers giving considerable detail of the rationale behind each of the items on the reporting checklist, the evidence that these things are important and that they're not being presented properly, and with lots of examples of good reporting. CONSORT and STROBE, for example, are two of about 5 such guidelines, and these are papers of 20,000 words or more. They're very long and give a lot of insight into general principles as well as specifics.
Okay.
And I guess all these papers are linked to on the EQUATOR website.
Okay, thank you very much. I've just got a question here from one of the participants, Rob Parsons, and his question is, or comment, his big question is, why is this happening? Is commercial funding too prominent? Do careers depend on successful research? And are scientists more overworked? Do you have any kind of reflection on those comments?
That's several questions, but I can see it on the screen, so I think. There is a slight paradox in that, on the one hand, there's huge pressure to publish, which is, I think, driving a lot of the selective reporting. But equally, there's a lot of research that isn't being published at all. And it's not completely clear to me why that contrast exists. I don't think this is entirely a commercial issue. In fact, I think we have to recognize that people have several types of vested interests. As well as commercial interests, people have career interests, and certainly they have intellectual interests. If you have spent some years developing a theory and a body of research on that points in a particular direction, you might be quite reluctant to publish something that seems to contradict what you've been saying previously. When I say you might be, I think you would be. So it's a very complex issue. The current thinking is, I think, of many people, is that all randomized trials should be published. And there are groups in other areas who feel that some of the principles should be adopted for other types of research. When I say the principles, I mean publication of protocols, registration, and where possible, full publication. But it's much harder in those areas. Do careers depend on successful research? Yes, I think they do. I think the problem is what we mean by successful. And significant results should not be the same as successful research. I think if a research project is important, then the answer is important, whatever it is. If you don't care about the answer unless it's pointing in a particular direction, one should question the way that research is set up.
Okay, voy a hacer eso mientras tanto. Okay. Okay.
Okay, thank you very much. I have another question here from Isabel, and she wonders, is there any data on whether journals that require reporting guideline checklists have improved reporting in the articles that they publish?
Well, I think that is a large part of the Cochrane review that I mentioned looked at that question. The difficulty is the word require. There are various levels of requirement, so that, for example, a journal may send its instructions to authors that authors should follow one of the following reporting guidelines, as whichever one is relevant to their study. But authors probably realize that this isn't going to be checked very carefully. The evidence is, yes, that there is some improvement, but as I've said, even in those journals that are strongest supporters, that it's still not nearly as good as it should be. And it's partly lack of resources, it's partly the human weakness, I guess. People can't see, they don't want to spend a lot more time than they already do in writing their paper, and then to be told, that, oh, well, you've got to put this in and that in. They don't like it. But to be honest, I think too much is made of that. I think if you know when you start to write the paper where you're heading, that it shouldn't be too big a problem. Where it's a problem is if you write the paper first and only then have a look at the reporting guideline and find that there are various things you haven't included. I can well understand, and that might not be a nice situation. But anticipation should get rid of a lot of those difficulties.
Okay, thank you. Thank you to everyone for submitting your questions through the chat function. I'm just working my way through those. So our next question is from M. Helton, and they're wondering, from the perspective of an editorial office, how would you suggest monitoring each article to ensure that reporting guidelines were followed?
Yeah, well, that's a fine question, and I think, personally, well, I know that resources are scarce in many editorial offices. I think the authors have to do the bulk of the work here. What some journals do is they ask authors to submit with their manuscript a completed checklist. What that normally means is that for each item on the checklist, they indicate on which page of the manuscript the authors have addressed that item. If you want to be stronger than that, you could actually request page and line number, and even what is the actual text in the paper that relates to that. But the most common approach is the first one, where you ask authors to say on which page they've dealt with something. And in principle, that should help. The mere fact that they've said a page number suggests that they've had to think about this, and that they will believe that at least some text does address this point. Now, if you were to look closely at it, I think you would probably find that in not all cases is the relevant text adequate, but it's the minimum, and it's doable without much effort in the editorial office. The other thing which some editors probably do, I don't have this explicitly, is that they identify a handful of items which they think are the most critical, and they check that those are included. That's not to say that other things aren't important, but resources are limited, and it's better to check a small number of crucial things than not to check anything. But the third thing, I guess, that could be done is to suggest to peer reviewers that they take note of the relevant reporting guideline when assessing the quality of the manuscript. As yet, I don't think a lot of that goes on.
Okay, thank you for that. I've got another question here from Bruce Ryder, and he wonders, do you think non-registered trials should be published? Whereas registration is obviously preferable, should non-registered trials, once performed, be suppressed?
Okay, well, I mean, I would like to see all trials registered so that the question becomes an empty one. Some trials are not registered, presumably because the types of intervention they're looking at aren't covered by the legislation or the local rules. I find this very difficult, and to be honest, I think it goes beyond my personal expertise. I think it would depend on why the trial was not registered. It's, on the one hand, clearly, if you had a very strong policy against publishing unregistered trials, and indeed the journal I co-edit does have that policy, then it might help to dissuade people from failing to register in the future. But is it right not to publish the results of a trial for that reason alone, when participants have in good faith been enrolled and studied, perhaps at inconvenience or even risk for some period? Is it right to withhold those results from the public? I think that's a very difficult question, and it's not as if the research itself was unethical necessarily. In fact, probably wasn't, except in this one element of not registering. But I think it goes somewhat beyond my area of primary concern in this presentation, so I don't think I want to say any more about that. I recognize it as a difficult area. I'm not really sure who should make that decision. I guess it would be good if all journal editors came to a collective view on that. But at the moment, it's clear from some reviews, which I haven't mentioned, that a lot of trials that get published were not registered. And a further block of them were registered too late, compared to what's recommended.
Okay, thanks. The next question is about data presentation. And Ladin wonders, how do you feel about reporting more and more data from the paper online rather than including that in the hard copy?
Well, of course, before I explicitly address that, many journals are only online, so nothing has a hard copy. I think that the question I'm most often asked when I talk about this topic, and I have been doing so for many years, the most common question is about space, that many journals have space limits, and how can you get all this information in when you've only got 3,000 words or whatever the number is. I think the availability of web appendices for most journals renders that problem rather a non-problem, but it is still a slight issue as to which information should go in the main report and which in the appendix. And I've certainly seen examples, even in leading journals, where information I thought was of primary importance was relegated to an appendix. And in some journals, it's not at all easy to find the appendix. Journals vary in this, as you probably know. So what do I think? I think that in principle, having extra results in an appendix is a good thing. I think it needs to be used really for non-primary results and non-primary methods, but to have the main stuff in the main text remains the way I would go. There are concerns about the extent to which the extra material is being peer-reviewed, and many journals are unclear about whether these appendices are indeed peer-reviewed or not. But I think that's a technical point. In principle, how do I feel about it? I feel positive about it. I'd much rather have this information in the public domain. I would remind listeners that for most research studies, there is only going to be one article. If it doesn't go in there, it's never going to be published. Those data, that is, those extra data. So I'd much rather have an appendix. But I would prefer that there was a proper link to the specific appendix on the website, rather than just giving the journal's web address, which some journals do.
Okay, the next question is from Sabina, and she wonders, how can funders ensure that the studies that they fund are being published?
Yeah. Well, if it's a clinical trial, then it should have a registration number, to pick up an earlier point, and it should be quite easy to search the literature. But that doesn't apply to all the other types of research. Clearly, funders can, and I believe should, ask the people they fund to send copies, electronic copies, or at least details of all the publications that arise from that research. If they don't receive any, then they can certainly chase it up and find out why not. And as I said earlier, what should their reaction be? I think that there should be serious consideration about whether they should give further research funds to someone who hasn't published anything from the last grant they had. It's complicated by the fact that research is well, you know, there are many people involved in a research project, and I guess it's the grant holder who is ultimately responsible. But there aren't, well, I say that it says, I see comments about incentives. The Health Technology Assessment Programme in the UK has a very strong incentive. Basically, they are both funder and publisher, which puts them in a unique situation. But they withhold 10% of the grant until the report is published. I think that's a pretty good way of working, but most funders don't act as funders themselves. But nonetheless, it could be, if you really want to take this seriously, you could withhold a percentage of the funds until the main results have been published, or at least submitted for publication in some way.
Okay, thank you. The next question is from Catherine, and she wants to ask, do we need to rethink article length, online or in print, to enable more adequate reporting of studies? Well,
I already said something which I think addresses this a bit. I was impressed by one journal which had a word limit for the whole paper, excluding the methods section. So basically recognizing that the methods section is really important and didn't want to squeeze that. So you were given however many words it was, but the methods section could be whatever length it needed to be. I've only seen that once. I think that any attempt to say what is the maximum number of words, or the maximum number of figures and tables, the maximum number of authors even, is pretty daft, because these must vary according to context. So I would prefer journals to have these as suggested figures rather than absolute rules. I I think otherwise they're anti-scientific. Some pieces of work can be described adequately in 1,000 words, and others genuinely need 4,000 or 5,000 words. But I do appreciate on paper journals there is an issue of space, and as I said, I think web appendices can get around some of that difficulty.
Okay, thanks. Catherville says, sometimes the researcher may collect data, but it may take time for him to write it. By that time, it may not be useful for the scientific community. In that situation, what should the researcher do?
Yeah, well, I think it's not always easy to know what is, I mean, obviously if someone else has effectively done the same piece of work and published it, then maybe you should just not bother. So, for example, if it's a systematic review and someone else reviews the same literature and publishes it, it may not be worthwhile publishing another paper reviewing exactly the same studies. In practice, however, these things are never that straightforward. There are different reviews will look at different studies and take a different perspective. So even there, I'm not sure that that's so relevant. We're currently trying to publish in the journal I edit, Trials, a report of a trial that was initially submitted for publication 11 years ago. It was rejected and somehow got forgotten about, and I persuaded the authors to submit it, and it's now in our system. I think it's difficult to judge whether or not evidence may or may not be useful. I think I would obviously prefer you didn't get into this situation, but I realize sometimes it happens. I think a better test is to try sending it to a journal and see what happens rather than making the judgment yourself.
Okay, thank you. And I think we need to wrap up very soon, but I just wondered if we should ask one more question, and that comes from Andre. And he's a legislator working on the new Swiss legislation for human research, and he wonders what you think is the role of legislators in this area.
Gosh. Well, I didn't mention legislators in my slides, as you will have noticed, and I have to say I'm not completely sure what the role of a legislator is. Okay, so I didn't mention SPIRIT either, so let me just say briefly that SPIRIT is a recently published guideline for the content of clinical trial protocols, and it overlaps with CONSORT in many of the concepts, because clearly the methods section of a clinical trial protocol should look quite like the methods section of the subsequent journal article. Should these guidelines be endorsed by law? Gosh, while it's terribly tempting to say yes to that, as I'm involved in these guidelines, I find it a bit scary, I must say. I think that I'm struggling slightly because I'm not sure at which point that this is relevant to legislation. I can't really ask for very easy, or maybe I can ask for a clarification of what exactly is meant by the question. I do think that these guidelines are hugely helpful in principle to any stakeholder group who is concerned about getting the maximum value and the maximum understanding about research that's being funded, and indeed some of them to help people decide which research to fund. I just think that it's too important not to take account of these things at all steps of the process. But I'm sorry if I sort of slightly ducked the question, because but I feel a bit uncomfortable about making them legally enforceable, because ultimately, even though these are consensus statements, they are still the opinions of groups of people, and while much of what's in CONSORT and so on would not be argued by most people, to make them mandatory in the same way that registration is mandatory, I don't know. Certainly, maybe that needs to be given more thought. Certainly needs to be given more thought by me. I think I'll probably leave it there.
Okay, thank you very much. I'm sorry, everyone, we've run out of time to answer any more questions. I don't know, but thank you very much. That was a really, really interesting webinar. Thank you all very much for participating. The PowerPoint presentation and the recording, when it's available, will be posted up on our website. So thank you all very much for joining.
Okay, bye.